Great. Welcome back to Healthcare. It is the 1 o'clock session, and we're going to talk about budget adjustment. So we've heard from DEVA, DMH, the VNAs, and Howard Center. So we're just going to take them separately and just have a conversation and then just see where we end up here. And our role is to determine what we recommend to House appropriations. Remember, budget adjustment, there's no policy changes in any of the information we've heard. This is all, current programs, funding changes that is being requested either by the administration or by community agencies. So let's start with DEVA or DMH. Let's start with DMH since we just heard from them. So DMH had 3 adjustments. One was travel nurses are high, continue to be high, although they've talked about lowering the rate and trying to find some solutions through hiring. So that's the one. And then there was the PNMI, and then the $1 million mobile crisis, which went from general fund to global commitment investments. And global commitment investments, just federal dollars. So basically, we saved $1 million in the general fund. And we will be hear more about the mobile crisis program next week. So any questions, concerns, thoughts about DEVA?
D for DMH?
DMH.
Hi.
Leslie and then Art.
Yeah.
I just wonder if it's fair to say, if we add the mobile crisis, which is the 1 in the red and the 85, it's pretty, well, it's not gonna have a lot of impact, is what I'm thinking.
Right, I think it was 1 point, again, I apologize, my computer died, so I don't have the spreadsheet up. No, 1.7 million is what they're asking for to cover,
Those 3 things.
to cover basically the traveling nurses. So the 2 things plus the 1.7 million will cover the cost of the increase in traveler nurses.
And I'm not seeing how we have a choice not to do that, not to honor that.
I mean, it would mean that we wouldn't have some beds open, so yes, it would be a big policy change. All right.
I'm looking at the up-down chart, because to me, that's the compilation of everything.
Yep.
And quite frankly, I'm trying to understand, what I'd like to know is what we budgeted and how much up it is, so I can get a sense of it. Now, it looks like we budgeted 35.6 million. Is that right? Let's drop back. Let me start over.
Okay.
General fund money. I'm only concerned with general fund money. I don't care about the other.
Okay.
So it looks like we budgeted 35.6 million in general fund money.
25.8.
25.8
I don't know where you seeing 35.
in the yellow under GF.
I see,
Sorry to ask.
I see 25.2.
Chart, yeah.
Really?
Are you looking at the,
We're gonna ask Claire, which I really hesitate to do because she has.
This is coming off of what Clear sent just now?
what's that?
This is coming off what Clear just sent right now? Is that, have I got?
I'm gonna pull it up. We're gonna pull it up and put it on the screen.
Okay.
So we're looking at DMH.
I'm hitting Department of Mental Health budget upside down.
Oh, we're looking at DMH?
That's what I'm getting.
Yes.
Oh, I'm looking at DEVA. Okay.
That's my fault because I said DEVA a couple times. It's
I have a
DMH. Yeah.
feeling.
Horse of a different color.
Yeah. Do we still, let's just put it up real quick, so we can look at it.
So which one are we looking
We're
at?
looking at Department of Mental Health.
Okay.
Oh, the one we just went over.
Yeah, one we just went
Okay.
over.
I thought
That
we
had
were looking at the other.
That had the 3 line items.
Okay.
Traveling nurses, mobile crisis, and PNMI.
I had my mind on the other.
Okay, yeah, no, that's fine.
Gotta do both anyway.
Yes.
2.5 million.
Okay,
Oh, so we're not getting the right thing.
Yeah, 25.3, okay.
okay, so,
We could just do it from here.
yeah, okay,
Yeah,
great.
yeah, I see.
So you're, keep going.
So, Nolan, just in the general fund, if I go, I see the 25.3 roughly. You go to the bottom, the very bottom in the dark blue, and you have 26.3. Is that not,
That'd be the new number.
I
If
mean,
you pass PAA, that would be the new number.
that would be the new number, so it's
Should be the,
increasing by about $1 million.
yeah, that should be 25.2 plus the.
Right.
Okay, that's what I wanted to know. And it's the same with Diva, correct?
Well, let's stick.
You're gonna stick with this.
Let's stick with DMH, right?
Gotcha.
So it's going up about $1 million because we had savings in one place, but we need to cover travelers.
Gotcha. Okay, yeah, I'm good. I
Okay.
just want to understand.
Okay. Any other questions on DMH? Hi, welcome to the conversation link.
I'm sorry.
It's okay.
This may be the dumbest question
There's no
ever.
dumb question.
Yes, there are. Well,
No,
let's
there are
not
not.
say that. And it may have already been asked, but I was confused because I had asked about the carry forward. And Nolan, I believe she said that that's what that 2,772,000 is. She said that is carried forward. And if it's carried forward, why isn't it showing in the budget like Divas that it's being offset? Why are
Because
they
it wasn't
asking
carried
for it?
forward, it was reverted.
Reverted.
It was reverted, and then they went back to finance and management and said, we need money for this. So that is no longer carried forward.
Yeah, so it's just like their internal process.
Right. So it reverts back into a pot.
Into a pot, into the general, it goes back into the general fund.
And then all the agencies go to finance and management and
Can we
say,
have some of that
this is
back?
what we need.
It would have been less confusing if they just said that's our carry forward.
I know,
right.
Yeah,
But instead they were like, it's going here and then we got it back, but it's the same
We
thing.
gave it away, but then we begged for it back and
But
they gave it back.
essentially, it would have been just as easy if they
Right.
were like, we got permission to use our carry forward for this. And so we don't have carry forward because we're gonna put more money into this.
Okay,
That thing would have been a lot easier just to say that.
No, it wouldn't have, because then we wouldn't understand the spreadsheet as much. Like those of us who look at the spreadsheet are wondering like, what the heck? Why is it in central office and then it's over here? So I appreciated their transparency. It helped me to understand what I was looking at a lot.
well, and I also appreciate the fact that we're learning about things being reverted back to a general.
Yeah, definitely.
but I mean, in essence though, when we did the budget last year, it was not in the general fund. And I realized that money goes into the general fund over time, so. But if we thought in July that we had this big pot of money we were starting with, and here's how we allocated all of it, they're not coming to us saying, we want more. And so we're either gonna take it out of additional revenue or that we got that was, above projection. We're not gonna borrow or take it from somewhere else. We're basically, it's the same money that just got thrown back into the general fund and now they're taking it back out. Am I right?
Yeah, I mean, it's like, yeah, it's all.
Yes.
Okay,
it's all,
Yes.
all right.
So how does it, we've sort of ventured into like appropriations talk. And I'm kind of wondering, how do we get back to like, take that the same question and sort of translate it to our policy intent and say, back to my ongoing question of like, how do I follow this thread of the legislative intent of that original appropriation? So not quite sure how to frame this question, but how do we, if we take each of these requests, the three buckets basically on DMH, and we say, okay, is this a yes, no for us? Regardless of how the funds were transferred at AHS, if we want to consider the yes, no to each one of these three buckets, is our job just to look at whether or not we agree with
Policy.
the policy?
Yes.
Regardless of the appropriation source or
Yes.
process?
Yes. Yes, our job is policy. And so, I mean, we can look at the source and we should ask questions about the source. And if we see that we're not happy with the source, we can bring that up with appropriations. But in this particular case, I'm not seeing, it's not complicated, right? It's money from general fund to global commitment investments and then, paying for travelers through $1 million. So I guess, so I know, I understand your question. I'm not sure it's needed here.
Got it.
Do you think it's needed here, or you can?
No, like I see, like, okay, yes, I definitely want our, I agree with all of these requests. On some of them, I do have questions, and I think your answer clarifies that they're questions that I can take to appropriations.
Or take directly to the agency yourself, either way, yeah.
Got it.
But really, it is policy. Unless we are concerned that we are losing money, that our intention through the budget was for it to go to a certain thing, and now it's not going to that thing, it's going to this thing over here. That also is a policy thing, although it's following the money, right, that we would have to talk about.
But then that would mean that we would have to know what was reverted and what was carried forward.
Yes.
Right.
Yeah.
Yeah.
They're not telling us that.
Right.
Can I say one more thing?
Yes. But wait, what do you mean they're not telling us that?
Well, they don't tell us how much money they carried forward. They don't tell us the money that we appropriated that they didn't spend because the program didn't get off the ground, or something like where it was less than. I mean, like yesterday, Diva gave the example of the immigrant. The health advocate is going to give me the name of it that. Yeah. And unless we had asked and they gave that example, we would have never known that.
That is why that's why we are here, and we need to ask those questions.
Yes, but, so we didn't get that from DMH. That wasn't what I wanted to.
Keep going.
Now, this is only my fourth BAA. And granted, I came in the age of COVID. But the thing that has shocked me most about both these ones that we've seen, there doesn't really seem to be anything in it other than, again, sort of truing up. And I know that's the intent of the BAA, is to true up. But in my previous three BAAs, it feels as though there was always something in it for kind of an emerging issue that really needed to be funded. I mean, I remember last year we had the children's beds down at Southwest North Medical Center. I'm like, last year, didn't we put a huge increase into the designated agencies? We did that in the BAA. And then additionally, we did it in the budget.
So I'm going to answer and then Nolan can answer, but
We did like.
you're referencing BAAs where we had a lot of money coming in from outside sources.
Okay,
Quite frankly, this is much more similar to the BAAs before that.
so this is real world BAA.
Yeah.
I've just never seen one
Yes,
before.
exactly.
Okay.
Yeah.
And we haven't particularly had any outside advocacy. We've had two. come in and ask, and I
Yeah.
seem to remember that there was always sort of a slew of,
And those people know to come if they need money in the BAA, and they have not, I've reached out to some. And so this is, I mean, this is what we're,
This is more real world.
this is more real world. I mean, there's,
It's all we've known is the other.
right, and
Yeah.
I want to say that and also say there are still a lot of issues that are
Yeah.
really important, emergency-related issues that are happening in the state of Vermont. This is real world. This is what we have in front of us, and then we'll see what comes in the budget. Do you want to add anything?
Yeah, when I spoke to someone from AHS, I made a comment, similar, like, there doesn't seem to be a lot of policy in there. And they said, yes, that was the point. We really
Right.
want to focus on technical correction, just but balancing the budgets,
Yeah.
and less about throwing big policy in.
Yeah. And BAA prior to the pandemic really was never about policy.
Right.
but we did, I mean, we heard from Howard yesterday. And you asked, or I believe Daisy asked, if they had considered that. And they said that they
Considered what?
considered putting that in the BAA, and they said that they had had communications. So my question is, who else did they have communications with? And they just decided they weren't going to either they weren't going
Again.
to entertain them at all.
So again, those are questions we can be asking. We did not ask them to provide us a whole list of organizations you've been talking to, right? We didn't ask those questions. Maybe we should start asking those questions. Maybe we should do the whole budget process a different way. I'm open to those ideas, but that's not what we asked for.
Okay.
And they're gonna tell us what we asked for. Hopper?
Thank you. Are we on record now?
Yes.
Okay. I just wanted to make sure we're not just having a conversation. Madam Chair, the reason I asked the question that I did about Howard today is my understanding is there's a request for X amount of dollars to cover this program for the next 6 months. My question, I wanted to make sure if we're going to do that now, that they have submitted to the agency for next year's budget funding for that program. Because if not, that means they're on their own to find funding, or we're going to have to go through a BAA thing again.
No, so what will happen with Howard Center and this funding, if we continue it to the end of the year?
Yeah.
I would bet they would be back in front of us at the budget time to ask us for the next full year, because it is not
That's
going to
okay.
be in the governor's recommended budget.
Okay, that's fine. I just wanted to, whether it's in the governor's recommended budget or not, I wanted to make sure that that agency, the Howard Center, was in fact asking the state agency to help them with this
Yes.
program. That's why I asked the question. Now, they're gonna come back. It doesn't matter about what the governor wants or not. What matters is, did they apply to the agency to help fund that program in the coming year? We're doing it for the 6 months. I'm interested in the next full year.
Yes, and I am as well. And based on what was said yesterday in testimony and today, I think that will be a discussion we will have to have at budget.
At budget time.
Yeah.
Can I make one clarification? So the Howard Center ask is one-time funding.
Yes,
BNA ask for LUPA is not.
yes.
It's base. They're asking for it to be added to the base.
So wait, we're not there yet.
Okay, I'm just trying to see
Yes.
the difference that some of these are.
This is just they're asking for 166,000 to get through June, but we're not there yet. Can we stick to DMH?
Okay.
So I think there's a lot of questions about following money. And so I think how we deal with that is that I work with Daisy, who is our budget liaison, and Nolan, and we come up with a process that we will use for budget. I think what's in front of us is no policy change. Are we comfortable with what DMH is asking us? And do we recommend that we cover traveling nurses and that we save general fund money by moving it to global commitment investment? Any other questions about that before we kind of do a quick straw poll?
I would just say, I think I did the math right on it. It's like almost a 4% increase in what they asked for. The overall, in general fund.
I'm sorry, what?
Art is saying that the DMH budget adjustment is a 4% increase to the original general fund ask. I don't think that's
I don't know.
accurate.
That's
You don't think so?
No, 25 million was in the general fund. They're asking for 996.
Right.
So that would be about 4%.
4%.
Better than half this. Well, that-
Okay.
I just throw it out there.
No, that's. All right. All in favor of supporting the DMH recommendation for a budget adjustment? Topper, yes or no? Oh, you're on mute. You're on mute.
I only get 3 votes all year, right?
Oh, yes, right. It's a straw poll.
Oh, this is a straw poll? Okay, then I can vote.
Yeah, I think that's right.
You know what? I'm gonna say don't vote. I'm gonna say don't vote, just to be on the safe side.
Just in case.
Just in case,
Save it?
save it.
Okay, good.
Oh,
Okay,
That'd be for the whole day. That would be for each one.
because,
Aren't recorded.
huh?
Polls aren't recorded at all, so just want to be.
We don't need his vote, and I want to be safe that we're not causing him problems later on.
Yep.
So, all right, all those in favor of supporting the DMH budget adjustment?
Still a straw vote?
It's still strong vote, but I mean, it counts, like
I know.
I'm gonna say, so there's, how many people are here? 9, 10, 9.
Nine.
Okay. So DMH is 902. Okay. Eva. Eva had a carry forward of $4.4 million. So they had a bunch of technical changes, administrative technical changes with contracts and software. And then they had program changes. The annual Medicare buy-in, which is a federal requirement. So that was number 4, if anyone's following on that narrative. Number 5 is a Medicare Part D clawback. That's federal. Number 6, 7, and 8 are net neutral. And then we had an increase, a couple increases, 9, 10, 10 and 11 are federal.
Nice.
I must be using your.
Well, you were out of the things. So the rest
Okay.
of it was federally required that if you're gonna cover, then you then have to cover the supplies.
Okay,
So that's basically the supplies.
Where are you
okay.
at?
But that's what
The rest, the rest.
narrative, so I don't know how that translates. We haven't heard the correction, if it matters. It may not.
We've come into compliance with CMS guidelines to cover supplies. And so now we're covering them.
So now we're covering them. So that's 9.
That matches the ups and downs.
I think to me, it's a federal requirement. I'm not gonna worry about what the narrative says right now. We'll get the update. All right, and then number 10, FQHC adjustment is a federal requirement. Hospice rates is a federal requirement. Brattleboro retreat is moving from global commitment to state as patient mix doesn't allow based on the feds. That's also federal. And then we have the ACO settlement, which we talked about, right? So they're paid a global budget. They provided care for less. So DIVA has to pay them, and then that money goes to their providers. It's 13.
So I'm not sure this is appropriate time, but I'd like at some point to understand how that money is dispersed, like in a little more detail. Like just not to providers, just.
It's dispersed to the providers who are part of the ACO model.
So how much did each provider get? What's an average? How does it work?
Based on their attributed lives.
Yeah.
I get it. But other numbers, but.
Okay, then that's,
on it.
Yeah.
so I would reach out to the ACO to get that information. That won't be something that we take up here. And then 14 and 15 is, there's no money yet attached that we know of. Right now, there's no money attached. Number 14 is a federal requirement where you're on Dr. Dinosaur. You have to do, as every Medicaid person insured by Medicaid, you have to monthly provide updates if your income has changed. So children could be removed from Dr. Dinosaur if their parents' income changed. Federal government is saying that's no longer allowed. If they're on Dr. Dinosaur as of January 1, they stay on for the year, and then the redetermination is, or whenever their date is for the year. And then after 12 months, they are redetermined to see whether or not they should stay on. So that's a federal requirement. And then number 15 is a pilot program that doesn't have money attached to it in regards to the budget adjustment to do a global payment for, so you sign on, you're attributed to Medicaid in January, and then the global amount is decided between DIVA and provider and OneCare, but then there's always people coming on and off Medicaid. And so those people are on a fee for service schedule. So this is to take that grouping and provide a global payment. So it's basically just not paying fee for service, but paying a global commitment. So the only thing in this whole packet from DIVA that is not federal are the 3 items in the administration.
Which numbers are they, Lori? I missed that.
Are you in the narrative or are you?
Yeah, I'm in the
Okay,
narrative.
so it's page 1 of the narrative under administration 1, 2, and 3.
1, 2, and 3.
Yep, total staffing related budget changes, the contracts, technical adjustment, and the,
Those are the only ones that they can be tinkered with
if we chose to, right? So there's those. And then under the program, which starts on page 2, it's really all federal except for the ACO, but that's a contracted amount. That's number 13.
Could we talk about that one a little more? I'm not you could just tell me. I don't understand what that is.
Okay, so Medicaid through DIVA provides a global payment or a value-based payment to OneCare
Okay,
for all the lives that are attributed to them. So your Medicaid, you're insured by Medicaid. I'm insured by Medicaid. I go to provider A. Provider A is a part of OneCare. There's a lot of those providers. So OneCare works with all of those providers and says, you're going to get this amount to provide healthcare to all your Medicaid attributed lives. Okay, so
yeah,
OneCare and DIVA up here have a number, and then OneCare has a number through contracts with each of their providers. And there's risk associated with that. And so let's say the number is 300 million. If OneCare spends more than 300 million, or I shouldn't say OneCare, if the providers within the OneCare network spend more than 300 million, then OneCare is on the hook to pay the state the difference. If they spend less than 300 million, the state pays the difference to OneCare, who then, based on the attributed lives, give payments back to the providers. So it's an incentive to keep people healthy and provide the care that's needed.
okay.
And so this, and we can talk about this more with Diva at some point, because I'm not sure we have talked about it much. But
It's like the
Medicaid,
biggest hit here.
but the Medicaid One Care program has really worked well in the state. And so we can get some more information from them. But yes, it's the biggest dollar amount,
Yeah.
but I would say it's a positive because it's helping people stay healthy. And it's providers doing the work that they need to do.
Okay.
But it is contractually related, contractually committed, so we don't really.
Yeah.
Alyssa Topper and then
I
Maureen.
just wanted to, it's a good thing because it means that those patients under Medicaid did not spend as much money in healthcare dollars
Right.
as they would have. So it looks like it's a hit, but it's actually a savings.
That was my point. Downstream, it's a positive.
I'll take your word for it.
Thank you for that clarification. Topper and then Melanie.
Yeah, that, whatever. I just want to know.
Just to add what you said, Madam Chair, one of the main reasons for One Care is to control the cost of healthcare.
Right.
And if there's money left over, that means we're controlling the cost
Right.
Doing well.
and providing quality care at the same time.
Yes, exactly. Thank you. Topper? Melanie?
So just because I've never done a VA, it's like common, these numbers, like this kind of volume? Just
Yes,
this point
for
of-
Diva it is.
Okay, yep.
Yeah, and they always do it administrative versus program, which is great. I will say, since you weren't here for the budget too, when they come back for the budget, they actually provide us a book for their budget, and it's really helpful. It helps us really dig in to understand, what the Medicaid program is and what they provide to Vermonters.
But we have to ask for it.
But we're getting it this year.
But this looks like within the,
Yes.
this is what it looks like.
Yes.
Okay.
Yeah, again, yes, this is back to reality, but. Okay, so if I'm reading this right, it is a decrease of $1.68 million for the Diva budget when you factor all that stuff in. All right, any other comments?
Where are you getting that?
I'm getting it on the BAA summary. I'm not looking up the spreadsheet.
Yeah, I'm looking at the chart, the up down.
May I ask a question about that?
You may.
And maybe Nolan can chime in. So if they're down, if we're adjusting them down, why they use so much carry forward? Why wouldn't they just use carry forward to put them at zero?
Sorry, which line are we talking about?
Yeah.
Well, I'm just talking about the total. So the total
So
decrease.
what's weird about Diva is because of different matching rates, it might look like a down. Federal dollars,
Right.
it makes it look down, but it's so that it gets lost in that whole carry forward conversation.
Okay.
You can ask what their carry forward is, but that's a different question than what the total is. Like just
The carry forward was 4.4 million.
4.4,
Okay.
that's what I'm saying is if they're down 1.3, why
Well-
didn't they only carry forward?
They can only
down
carry forward
one-
general funds. You have to look at the general fund.
Okay, so the carry forward,
And the 1.6 was gross. So that
Yeah,
was more-
okay, got it. Okay, that answered my question, sorry.
Leslie?
I'm stuck on the carry forward, not by the number, but what it represents.
Yes, they're getting back to us on that.
Yeah, I just want to reinforce that. I knew that we talked about that, but I just want to be sure because
Yep.
I care about that.
Definitely. Okay. We do a straw vote on this one. There's no more questions? Any more questions on Diva? All right. Those in favor of telling appropriations, we're fine with the Diva budget adjustment. 1, 2, 3, 4. So 8.
I'm only not voting for it because I don't understand. I don't understand the chart. And
Okay.
until I understand it, I won't
Okay,
support it.
so Nolan, can you help Art understand it?
Well, again, if you look at the chart, the up-down, as I call it a chart, like, whatever. The far right-hand blackened in area says that we budgeted $183 million for this whole program.
No,
Where are you?
$183 million to section B 306.
Section B, okay,
Each of
right.
these different sections, so that's how much was budgeted just under that section.
Just under that
See the
section.
section on the far left, it's in gray.
Oh,
So you need to go down to the table, which is in purple.
120,
Total program,
See where it says DIVA fiscal year 24 BAA governor recommend?
yeah, okay, I got it.
That's where you need to look at.
I approve.
Okay.
Easier than
So nine,
I mean, it's just a matter of looking at what it is. I get it.
it's, yes, it's,
takes some time.
Yeah.
Well, I was looking at the first number, looking at the last number, but they're all by section,
Yes.
so I wasn't even, yeah, I get
exactly.
it.
Okay, so 902. So we are recommending both DIVA and DMH governor recommend budget be put forward to appropriations. Okay, great. So then we have the two items that came in. So we're gonna start with the VNA. So this is Jill Olson, who came to us and talked about the skilled nursing, right? So they are skilled nurses who go into homes to help Vermonters maybe recover from surgery or whatever their medical needs might be. And last year, we brought them up to 90%, I think. And now they are asking, and remember, they are not on the same fiscal year as the state. So that is why they come to us for budget adjustments in this case, because they are on a different schedule. And that was at the request of DIVA. So it's not like they're on a different schedule because
What was, when you said that, was which that?
the budget change, the fiscal year change for their budget.
So they are asking for fiscal, who's that? The visiting nurses are gonna change their fiscal year?
No. The reason they have to come to us in a budget adjustment is the Visiting Nurses Association is on a different fiscal year than the
Okay,
state.
but we can't change that.
I thought it was-
We could talk about it with DIVA,
Yeah.
but we're not changing it right now.
Okay, so if we could have it on the list for the budget, I think that would be good. So we don't have to do that every year. Because this is the second
Well,
time.
They're on Medicare's fiscal
Right,
year,
right.
which changes January 1.
Yeah, maybe it not be the right thing, but if this is gonna be the expectation,
Well, the expectation is also we get them to 100% and we won't have to do this anymore.
okay, that would be nice.
Yeah, but we can talk to them about that.
Yeah. Whatever we could do to fix it, I'm not sure the pathway.
Art,
This request,
yes.
is it necessary that we do it, or is this a good to do thing?
This is whatever our policy beliefs are to do. This is not part of the governor recommend. They are asking because this is a valuable service, as Jill said, to keep Vermonters in their home who need care and out of the skilled nursing facilities or the hospitals. They are asking for $253,217 of general funds, which will go up to $600,000 with federal dollars to get them to 100% of the Medicare reimbursement.
All right.
So this would be something that if we agree, and we'll take a straw vote, we'll send it either way, yes or no, send it to appropriations, and then it's in their hands of whether or not they want to fund it.
I'm testifying now, as someone who works in the hospital, I can testify to the dramatic impact it has on the flow of patients. Like, patients can't leave the hospital because there's no place for them to go, whether it's a skilled nursing facility, we're talking about home health now, or they end up in situations that are much worse for them and cost more money.
This is very important in Franklin County.
Okay.
You know, St. Albans is hour and a half away from some of these places. So.
Yeah. All right, any other comments before we take a break?
Just remember that the cost on this, I'm trying to pull it out, is the the cost on here with the, is half your cost. So
Right.
this goes in the base, so you're voting for it also to be a fully annualized budget.
Right, that's true, yes,
You
so,
should just know that.
yes, so the 253,000 will get us to July, and then it will go into the base, and so then for the full year next year, it'll be 506,000. And that will be 100% of Medicare. Okay, all those in favor? 902. Okay. One
I
more.
raised my hand, but
You know what, Brian? We had just had a discussion with Topper. Oh, well, actually, you can vote without a problem. Would you like to vote?
Tony?
I'll
Yeah,
support it.
Okay, great. So that's 10. And since you came on, do you want to vote on the DMH or the DIVA?
I'll support them.
Okay, great. So our new vote is 10-0-1 on all of those. Okay. Our last one is what came forward
Topper,
yesterday.
hands up. Topper has his hand.
Oh, Topper, hi, you're on mute, Topper. You're on mute, Topper.
I just want to make sure Brian realizes that's an official vote that he just did.
Yes, but he can.
Because it's COVID.
I wasn't really gonna say that. Yes, we understand that. Thank you, Topper.
Okay.
Okay. Howard Center. And again, I don't have my computer, so can someone remind me what the amount is, Daisy? Or,
Go ahead.
166,000. And so this is the cultural liaison program, been funded by a federal grant from the CDC that is ending. This would only get them through the end of June. And then either, and I think she said they're looking for funding, or it may come back in front of us, it may not. But we'll worry about that when it happens. This is, do we put forward 166,000 to get the program through the end of June? Comments?
Question.
Yes.
How many Samaritan houses is there of this sort in Vermont? I know we have one in St. Albans.
What
I didn't catch that it was related to Samaritan
It's-
houses.
Okay, well, when she spoke the other day, where are these people staying?
So this wasn't a residential program.
It's a residential program.
No, it's not.
No.
These are community members. These are community members, just like all of us in our community. And
They're just working at resettling.
do you want to?
No, it's not a resettlement program. And I noticed Nick is here also. I don't know if you want to add on to this, but what I understand is that there are 3 outreach workers who work for Howard Center. And so they're outreach workers who work with people who are
I meant
already.
Howard Center, not Samaritan House. I'm sorry.
Oh.
Okay.
And they work with people who are from the resettled community. That's the term she uses. You might be familiar with those people being called New Americans or something like that.
And Howard Center is the designated agency in Chittenden County. And so this is one of the programs that they offer. And so we've seen it with Bridges to Health in another part of the state, where they started by going into the farming community to help people with healthcare needs, make the connections type of thing. So it's a lot like, community-based care, right? Making sure people get the care. And in this case, I see it as making sure they get the care they need. And again, not going to the emergency department. I mean, that's so much of what we're looking at in this committee is, how do we get the services into the community? Daisy and then Art.
It is so much of what we do in this committee. In fact, I was just going to say, I feel like this is one of those programs that follows like every single one of our guiding principles. It's really remarkable how it does. So I feel really strongly about supporting this one.
Okay. Art?
It sounds like they're the conduit for care. They don't provide the care.
Correct.
They're the conduit for care.
Right,
They
exactly.
find the care places and get them there.
And some of the care may be offered by their colleagues at the Howard Center, but
Okay.
they're helping. So I think she mentioned one example where a Howard Center street outreach person connected this cultural liaison with, come on in and sit down, with someone who was in need, and that's how they got service. So yes, they're kind of a liaison.
And saying in here how many people from different countries, 100 resettled families, there it is, over 1,200 services across the area. Yeah, all right.
Any other thoughts, comments?
My only thought is that this is kind of preventative. You know, we're really helping people do better, get access to services. We're going to end up helping and I think long-term saving money and keeping health, addressing social determinants for not a lot of money.
Well, it came to mind, though, to me, and probably throw stones at me, but
Never.
Just pen.
yeah, just pen and pad.
Ever.
Could they not find volunteers to help? Could they not, because you're not doing anything specific, you're finding places. In other words, hey, come on in, help these folks find a doctor, find a this, find a that, find a place to live. But
that's
seems to me.
That's a job, Art. I mean, that's
maybe.
That's a job. I mean, it's not easy to navigate our healthcare system. But Mari and then Melanie, and then we're going to have to vote because we have a hard stop at 2.
Some of the things that these organizations do is go out into the community, let's say the migrant farm workers, and provide screenings and provide immunizations to prevent flu outbreaks, COVID outbreaks. And if I'm, yes, you can volunteer as a registered nurse, but not many of us have the amount of disposable, I don't mean disposable, but extra time to do the amount of work that's needed to do in the community. And I don't want a non-licensed person, just because they have a great heart and want to volunteer, doing that kind of work with me. We need someone who's connected to the system, where there's some oversight that follows data, and we're not having to rely on volunteers.
Well, there's a lot of
Thank you, Mike.
retired people that might be willing to help, though. I guess that's the point.
And I hope they do, because we need volunteers. I mean, without a doubt, right? So
There are places for people to volunteer in the statewide organization. There already is that there. And they also are looking for people. So we can't rely on already overburdened volunteer organizations.
Melanie and then Topper, and then we really have to vote.
Volunteers are wonderful. I think that there is a place for both. I think that something that was spoken to in the testimony for cultural liaisons is they have to have a certain skill set and an understanding of community, which includes often being bilingual, not only in the languages of the people, the cultural perspectives, and also our healthcare system. So that's more than a volunteer can sometimes command. And so I think having people that are acting in that professional capacity in those communities, we need to support, and it would be such a shame to lose that. And they talked about the institutional knowledge that is in these 3 individuals, so I fully support this program.
Okay, thanks. Topper?
Thank you, Madam Chair. This request is not for these 3 people to be providing services to people. They're liaisons.
Correct, yes. Correct.
So when Mari's talking about,
Yes, you're right. I'm just talking broadly in the world of providing these services, whether they're liaison or whether they're actual providers. We can't keep trying to rely on volunteers. We need these supports in a system, a network that works together, where we have oversight, we have access to information, and we can have longevity, and we can evaluate whether these programs are working or not.
well, in this particular case, from what I understand about this program, these are people who were scared stiff, had no idea where to go.
Right. So Topper, I'm sorry, hold on. So just for a couple of minutes, we're gonna need you to wait outside because we're doing another hearing right now and we have a room limit. So,
And I just got done with COVID.
yeah, so just until we're ready to get to the next piece, which I'm sure is for the bill walkthrough, if you can just wait outside for a couple minutes and then I will be out to figure out how we're gonna do this. Okay. Topper, I'm sorry, go ahead.
Okay, so these people, they understand the culture. In some cases, they speak the language. And what they do is they facilitate for these people the opportunity to get care that they need and remove the fear that they have, or provide them with knowledge that they don't have. They're not providing services. These people are helping people get to the place where they can get the services that they need, which beforehand they didn't even know about. I remember during the COVID thing, they had no idea. And people came to them, they got the health department there, et cetera, and the people were taken care of. That's what this program is all about.
All right, thank you, Topper.
Now, do you need to vote for this one or not?
I don't think we need your vote for this one. Unless you want to, that's up to you. All right, all those in favor? All right, 9. Brian, are you voting? 10. All right, 10-0-1. Thanks, everyone. This is just a preview for the budget, which is a lot harder. So, but I will work with Daisy and Nolan and we'll come up with a process to follow the dollars a little bit more for people. So, all right.
Is this it for RBA?
Yes.
BCAA?
Yep.
Really?
Wasn't that easy?
Yeah, what it was the past 3 years. This is-
You have a lot more to ask.
Huh?
All right. We have Jen joining us to do a bill walkthrough. I am going to say